So good morning, candidate McCarron, and thank you so much for doing this interview with us at Disability Rights Louisiana. We are engaging with candidates, either mayoral or city council candidates throughout this election season so that people with disabilities can be more informed when they go to the polls. So before we get started with my questions, I just want to give you a moment to introduce yourself, your district, and anything else you may want to add.
Perfect. Thank you. Thank you so much for having me. I appreciate it. I'm Aimee McCarron, and I'm running for City Council District A because, like you, I love our city. I was born here and raised here, and now my husband and I are raising our 6-year-old twins here. So I went to Ursuline in Noka where I studied musical theater, and then I started working in restaurants when I was 16 years old. And then throughout my time in college, at University of New Orleans, hotel, restaurant, and tourism management, I worked as a line cook and then worked my way up to catering sales manager for Ralph Brennan Restaurant Group. After that, I became a financial advisor with Prudential and got involved in Young Leadership Council at that time. And I was president of that organization in 2019. And that's how I met Councilmember Giarrusso, who I worked for the last 3 years as his full-time policy and budget director. So I really want to use that knowledge and my financial background and knowledge of the budget to make things easier and better for our citizens of New Orleans. I want to build a city workforce, to turn our streetlights on faster, to have this level of Super Bowl coordination every single day, and to just make our city, what it should be.
Great. It sounds like you have quite the background.
Yes, yes.
Uh, so for my first question, what step would you take to make New Orleans infrastructure and public spaces more accessible to all residents? And how would you ensure that residents with disabilities are at the table when decisions are being made about the city's built environment?
Yeah, so that's a great question. And actually, the coordination piece that I talk about in my opening, and I talk about this all the time, is we have a lot of projects, street projects in particular, that aren't going to get done because of FEMA. We've run out of money. So when we are going forward on making these plans for our infrastructure, we need to make sure that we're bringing everyone to the table, and that's including you all, to make sure that when we are doing a street project, we're also making sure that we're doing the correct curb cuts, that we are making sure that there are complete sidewalks. I mean, there are places, I've been walking the district and knocking doors, and like half of a sidewalk is missing and it's filled with grass. And I'm like, how can anyone, especially you all, if you're in a wheelchair or something like that, even mothers with baby strollers, nobody can get down these sidewalks, and it shouldn't be so difficult to get around in our city, even just going around in your neighborhood. So I want to make sure that we are bringing everyone to the table when we are planning out our next construction projects for our streets, and making sure that we are doing a complete street model where we are making sure our sidewalks are complete, that we're also having, our pedestrian walkways are properly striped. And, if we need to put more of those, like there's that on Carrollton at the Greenway, there's a button you can press and it stops traffic. If we need to do more of those in order for people to be able to get around better, then that's what I want to prioritize and make sure that people can get around.
Great. And how would you support economic opportunity for residents with disabilities? What steps would you take to ensure that jobs across the city, including city jobs and contracts, are truly inclusive and equitable?
So I think we've got to make sure that we have that inclusivity in all of our contracting. If we have outside contractors, or if we are having any kind of work done for the city, that we need to make sure this is in our contracts and built in there, and that our people that we employ are making sure that that's top of mind too. And, unfortunately, like City Hall is not very accessible. So at some point, we have to figure out how we make that accessible for everyone in our neighborhood. So whether it's what I've talked about specifically for District A, is I want to make sure that I'm in the district more, so people don't have to come down to City Hall. That I am in a different spot in the district every single week with a staff person, so people can easily access me and they don't have to worry about parking downtown and getting around downtown. So making sure that, we as district council members are out there and seen and easily accessible for you and for everybody in our neighborhoods.
Great idea. What is your vision for ensuring that residents with disabilities can access safe, affordable, and accessible housing in every neighborhood of the city, specifically District A? And how would you address both affordability and physical accessibility?
So, of course, anything that we are building or contributing to citywide for affordable housing, we've got to make sure that it's being built to code, and that includes all of, being completely accessible. Um, we've got to do a better job at using some of our buildings downtown that are not being used and having more transit oriented affordable housing, workforce housing. So, having housing where people actually work and near transportation hubs, and making sure that people that are coming into our city and working in our city can actually live in our city, as opposed to having to go, live in Metairie or even the North Shore and then commuting here, because there's not good transit, or there's not good transit options for that either. So we've got to be very mindful of, if we're going to be building affordable housing, it's got to be around job centers. It's got to be around transit. It's got to be completely accessible to people so they can get around and get to work.
Exactly. How would you expand access to mental health care in New Orleans, particularly community based services? And what role do you see the city playing in preventing incarceration of people with mental health conditions?
Yeah, so this is a good question, because I actually worked very closely with Councilmember Giariso on two things. So we worked closely on getting the New Orleans Public Schools funding to have their Thrive Kids program, which provides not just mental health care services in schools, but also really wraparound services in schools. So we need to make sure that that is completely funded, that we're working with our partners at Children's Hospital to see how they can leverage Medicaid dollars to help pay for that, so we can get more kids, more access to the kids in school. And then the other thing is, Councilmember Giariso created the Mental Health Collaborative with United Way, and I was the staff person for that. And we started to kind of basically bring everyone together, everyone who's doing mental health services together, to say, okay, who is doing what services are you offering, and how do we get that message out there, especially for people in the lower 9 and New Orleans East, where it is basically like a mental health care desert out there. There's only Metropolitan Human Services, but people don't realize that they're out there, and they provide transportation and stuff like that to appointments. So we need to make sure that that collaborative continues its work to get the message out there and make sure that all of the partners know who is providing what services and where the gaps are. Because I think that's, especially with nonprofit work, I just remember back from Young Leadership Council, and where it's like, people have their own little silos and they don't understand, who is doing what. So bringing that collaborative together, I think, has really been a good opportunity for all providers to understand. The other thing is that we really have to work with the state on increasing the Medicaid coverage or Medicaid reimbursement rates to the same level as Medicare, because for specifically for our providers for mental health care. Because right now, only, I think last session, they did only physicians, but we all know that physicians are not the only one that are treating people for mental health care. So we've got to get those levels up too, so that way people have more access and there are more providers available. So we've really got to partner with the state on hopefully getting that. I mean, I know the state is kind of rough with Medicaid at this point, but that doesn't mean we shouldn't keep pushing for it.
Right. So you started to answer my final question. So I apologize if this is the same thing. But how would you advocate for more equitable access to Medicaid and other healthcare supports for residents with disabilities in New Orleans? And what types of policies would you support or oppose?
I don't think there's really anything that I would oppose because I think this is, a much needed thing. And like I said, yeah, we need to work with our state partners to get those rates up so that way we can provide more opportunities for people. The other thing is, I don't know that anybody has ever convened all of the universities that we have here. We have LSU Health Sciences Center, we've got Tulane, we've got Xavier, we've got all of these great universities that have programs, education programs for these providers. So we've got to get together and see how are we working together to create a provider pipeline, and not just a pipeline, but how are we keeping people here? Because a lot of times, with Tulane, some of the physicians, they don't stay here after residency. LSU does a better job at keeping people here, providers here, because it's a lot of people that are from Louisiana. But we've got to do a better job overall figuring out how we can recruit and keep people here, those medical providers. And part of that is that we work as a city to get our basic services back on track so people want to live here. So they know that when they call to get their streetlight fixed, it's fixed very fast, or they feel safe and comfortable to live here. So it's two aspects. I think I would be that person to convene everybody at a table. I don't think we've ever really done that and said, how are we going to tackle this one issue of a provider pipeline and the Medicaid reimbursement rates, and then go to the state? And, if we have a coalition that goes to the state, with the council and our Orleans delegation, then that shows a message of this is a real priority for us and we want to get this done.
Great. So that is it for my questions, but was there anything else that we didn't cover or you'd like to add before we close this out?
I don't think so. I'm really passionate. I love the city. I grew up here, and I know last week was the anniversary of Katrina, and I think back on that because my parents, they could have decided to move on and not live here and not rebuild, but they did. And so I have that feeling of like, this is such a pivotal moment in our election season in New Orleans for the next decade, that we've got to get good leadership that is welcoming and inclusive to everyone, and making sure that our priorities are getting done. And so that's really why I'm running for city council.
I agree. I'm gonna turn off the recording and then we can chat for a second.
Sure.